What if you could sit down once a week with a colleague who's a flat-out warrior? This colleague wasn't a stud in dental school. He struggled. He returned to practice in his hometown, an area once labeled by USA Today as the second worst place to live economically in the United States. And this very same colleague went on to establish an historically successful general practice known worldwide. What if you knew someone that wanted to take you by the hand and show you everything you need to know, from treatment planning to leadership, to maximizing your journey in dentistry, or just life? You ready to be inspired? Welcome to the Lionhearted. Hi everyone, Dr. Steve Rasner here, and welcome back to the Lionhearted Dental Podcast. I'm doing this one today on a Sunday, so you're getting this with about 2 weeks left in 2022. So before I get to the topics today, and I'll get to them shortly, they're going to be my first two goals for you for 2023. And I'll come back to them in just a minute. But I want you to ask yourself, it's important, where are you? How does it feel? How was 2022? Terrible? Amazing? Or a horizontal envelope of non-growth that's kind of been happening for a while? I would venture to say that that's the case, the last one I gave you, for too many of us. Because it's hard, it is, to start something new. Whether it's any goal, getting in shape is not an easy thing to start to do. Changing your professional journey, for goodness sakes, is not an easy thing to do. But no one's going to come around to rescue you. You must believe me. No one's coming to save the day, and there's not going to be a better time 3 years from now. And that excuse too many of us use, including yours truly. If you really want to invoke change, if this year wasn't what you wanted, then you've got to reach deep, man. You do. So it seems like an appropriate time to talk about 2023 and what those goals very well should be. And I have two great ones for you. And I'm going to talk about two of them. I'm going to do the second one first because it's a little easier for me to get through. And whether you're listening tonight from D3 or especially if you're an associate, and certainly if you have your own gig, your own practice, the first one is really critical. And that is, you simply have to become amazing at something in dentistry. And that has to begin now in 2023. And I'm going to come back to that because as I share my thoughts, I know you'll get it. And I know off the cuff, just hearing me say those words is pretty nebulous. It's pretty vague. Go become amazing. What's that mean? I'm going to get specific for you. And the second one is for you to learn the art of delegation. And I want to go over that one first because I'm afraid that if I get into the first one first, I'll never get to this. And so when I talk to you about delegation, it really is about making the people that work for you accountable and making it worth them being accountable. Because delegation will save you in this career that you and I chose. It will. When you feel that you have to do everything, it is the beginning of burnout. And the only way for you to artfully circumvent that, for that not to happen, is to find the people that work for you that care enough. I mean, that's, you've heard me on these podcasts so many times talk about how important staff is. And then really, if you think about what I'm saying to you right now, I'm breaking that down, why that is so important. You have to delegate absolutely everything except leadership. That one's for you. And part of how people respond, how helpful they are in exercising things in your practice that make your practice special, is having a whole team that will take on delegation, and it's okay with that. And I'm going to give you just a few examples. There's many, many that I could give. But for example, new patient packets, okay? Now this delegation part is really not for my D3 listeners, and it is to some extent for the associates, because if I was an associate, I would design a new patient packet to go out after the first visit, as long as the people that I work for were okay with that. I'd customize it to me. I absolutely would do that. And, over the years, spent a lot of time. What is it I wanted this new patient to get in the mail? And we invested in lots of different ideas. We ended up with a little mini magazine that had my picture on it and things I had accomplished through dental school and afterwards that I was proud of, and the highlights of my personal career. Of course, I was very into sedation dentistry, which I made very clear. And, but more importantly, there was a one-page letter welcoming them as my new patient. I would, if I was an associate, treat it exactly as if it was my own private practice. And even if you were there for 1 year or 5 years or more, when you do a job, whether it's an associate in a dental organization or whether you work in anything, you always have to give it your best. You never should say, well, I'm not going to do that right now because I'm only an associate of the practice and it's really not going to benefit me long. No, that's not how you think. Patient feedback. See, if you don't have people in your organization that understand that when they have this job, these different jobs that I'm describing for you, then nothing works. Everything is just a bunch of waste of time. You must have people in place that understand the importance of the role. Patient feedback requires somebody in your office. We did it 2 ways. We would do what we call exit interviews. And listen, they're painful to do. It's really not easy to sit down and ask somebody, how did we do for you? Could we have done it better? What areas could we have improved in? What did you like that we did? It's really a tough job. And if you want to practice in a rarefied layer of the atmosphere, you have to get feedback. And you're not going to do it, doctor. You don't have the time to do it. And it's a little uncomfortable, actually, for you to do it. I think your patients would tend to be more honest or comfortable, I should say, if it wasn't you in the room. We also followed that with something we would mail to the patient and ask them to fill out. So when I say delegation, patient feedback, PR prompting is huge. Do you know that I've been in practice for 4 decades? It's a Sunday, and I bet you when I go in on Monday, I will be prompted by my Michelle, who takes on many of these roles, because she was the original. She was my original staff member 42 years ago. I know I'm fortunate. I get it. And I am getting to that stage in my career, which is kind of bewildering to me and confusing and sad all in one, because some of my staff members are retiring. I'm not. but they are. She hasn't, thank God. And she prompts me, and I've told you this before, whether it's a phone call needed to one of my patients because they just would appreciate me calling and they didn't see me at the last recall, and maybe they're 90 years old now, and maybe they've been coming to me for 40 years. You hear me? Often it's a card right on my desk. Often is, what is it would you like to send, or what would you prefer I send to this patient or that patient or this business in town? It is a big job. PR is a big job. Also, changing up the marketing. Having Michelle come to me, and now look, at the end of the day, I've written my own marketing for whether it's hard copy, meaning a newspaper, or having her come to me and saying, I think it's time for a new radio ad, which I do. But if she didn't prompt me to do that, I wouldn't do it. Because I know how easily a week turns into 3 months and it's the end of the year, just like it does for you guys. That is why. Do you understand it? I even have delegated. I mean this, and I know it's going to sound incredibly mundane to you. But we used to, over the years, we did all kinds of things. You hear me use the word palpably different. And what I'm about to say, these type of things don't make up for poor clinical care. But we had Otis Spunkmeyer chocolate chip cookies baked in the office every day. I mean it. We did it. And by the way, if you have a small practice or you are an associate, I mean, the oven's $100, I think. The cookies cost money. It's an endearing, warm little thing that your practice may do. Having somebody delegated that did that. So I could go to one person. When you have multiple chefs in your office, your dental office kitchen, you'll never ever be able to go to one person and get what's called accountability. The glass in my office, it's just me, I guess, or maybe some of you are like me. I have glass, I don't know. There's several doors that have glass on them between the reception room and the office, or even the front door. Somebody, I'm not kidding, in my office is in charge of keeping the glass clean at all times. The restrooms at all times. Follow-ups are huge, right? Do you have that? Do you even have a system? And I'm saying that to you because I have a system. And even with my system, unless I am right on top of them, and that happened, by the way, we go through periods as a business where everybody does exactly what they're supposed to be. But I guess 52 weeks in a year is a long time, and people drop the ball, and you can't let them drop the ball without accountability. You can't. I have somebody in charge. Now, you may laugh at this because why wouldn't I have a sophisticated light system? And perhaps this is just a non-issue in your office, but when we bring a patient over earlier for whatever reason, or a patient comes into our reception room, I need somebody at the front desk to physically tell the clinic, because in my office, they are separated by 75 feet. There's a long winding hallway that connects the clinic to the front desk and reception area. And I got to tell you, it just happened to me on Thursday. I had gone past the reception room. It was late in the day. I simply had a post-op suture removal of 2 implants in the area of 14 and 15. And I happened to see a patient that I know I saw 45 minutes ago sitting in my reception area. And the front desk wasn't busy. That's not accountability. And I was not pleased, and I let them know I wasn't pleased. And they were, I could go on with all this. Office repairs. Now, when you have a supplies, like there is many people that may have 3 to 4 sub-job titles underneath their title. Okay, especially in an office as big as mine that does several million a year and sees a lot of patients and has 7 operatories. You get me? But if I had 3 people, they would have a whole lot of job responsibilities. And by the way, I would compensate them and create an office culture and hopefully have hired that person and discussed that culture that I'm looking for at the time they were interviewed. And I've done a decent job of that, and I hope you do as well. Now, let me stop with that and get to the second thing. But I don't want you to overlook this. I'd rather you write to me. I'm going to be off for a month starting, well, as you're talking to me now, because that means I've already had a surgery. I have a surgery scheduled next Friday, but this podcast will have been recorded before that. So I have time during the last 3 weeks of December to answer emails or help you out. Give me a couple days after the surgery. I'm getting my lumbar decompressed and nerves moved around. And if I feel like sometimes my energy's been a little drained, I don't like to make excuses, but it's been a rough year in terms of pain, even right this minute. But delegation is what gives you enduring success, helps you avoid burnout. But I want to get to the other goal. And I told you that I would wish that you would simply become amazing at something this year in dentistry. I want you to think about it for a minute. Are you amazing in anything right now? Or more importantly, in dentistry, do you think you're amazing? That's important as well. I want you to think about how important it is right now. Those of you that take courses, right? Write this down. I bet if you go back in the next couple of weeks and look back over 2022 at the best treatment plan acceptance rate you've had in a given month or a couple periods of a week, the first 2 weeks of July or whatever, I can almost guarantee you that followed a course that you took. You know what the power feels like when you absorb all that knowledge. Wow, that's why that happens, and that's what I have to do. You get me? Confidence is everything. And think about this. I'm just strictly talking to you. I know on surface you're saying, of course I know confidence is important, but the real question is how confident are you? You listening, you, that listener of Lionhearted that may not be as successful as you want to be. Think about your clinical outcomes on the patients that come to you that think you are the best thing since sliced bread, right? Don't you do great work on those people? I do. I don't know. It is. And conversely, the patients that you can almost touch their doubt, their doubt about all dentistry, by the way, not just you. You're just the next dentist that they expect to not trust, right? You got somebody like that? Because I do. And think about their clinical outcomes. I had a patient last Monday. It was an absolute fight. Okay? She's married to a very successful professional, and she's a little full of herself. And when I put her in the chair, and I hadn't worked on her, I don't remember, maybe in years or ever. She thought that I understood that I can't put her back in a reclined position. She doesn't do that. And I was instantly compromised about everything I did. And the fight internally in my head was, and my back was screaming. And it was one of those moments, by the way, that you hear me talk about with you, that I wonder, are you kidding me? Is this worth it? And I always think it's worth it. Even with her, I was determined to do the best preparation. It was 2 crowns, number 4 and number 2. And I did number 4 first and tried to talk her out of number 2 because she just hates dentistry. She hates the whole thing. I hate the noise. I hate the sound. I just hate all of it. I mean, don't put me back either. And nope, no such luck. I did so great for her on number 4 that she wanted number 2 done in the same visit, which you can imagine was 10 times harder. Can't put the suction in her mouth at the same time either, by the way. Yeah, I have those patients. You better believe I have. And one sedate, of course. Yes. On a Monday morning, I swear to you, it was my first patient. And I was determined, and it was a fight, to do the best preps I've ever done. I doubt that happened, but I am confident that I don't think anybody else could have done any better than I did. And what I did not do is just try to get through it and make an excuse that it was her. I took on the case. But confidence, as I mentioned in a podcast a few weeks ago, is so connected to what happens to you and what happens to me. Do you know that 85% of the world, I did a little research, believe it or not, are affected by low levels of confidence? Are you aware that it can change from hour to hour? It's happened to me. But what you need to do, and when I talk like this, I don't know if you like it or not, but I always realize the importance of confidence in athletics and sports. The NFL playoffs, those my friends that are listening in Europe and elsewhere, the National Football League's going to have its playoffs in about a month. And at some point, you and I mean it, stay with me on this. We're going to watch a quarterback at the top of his game, like Allen from the Buffalo Bills or Patrick Holmes from the Kansas City Chiefs. And he's going to have 1 minute left and his team's going to be trailing. Okay? And that quarterback is going to lead his team to victory. And there'll be someone else on another team that's going to have a minute left. And he's going to throw a pick, an interception. And he might have played a pretty good game, but they're going to lose. That's confidence, man. And I remember so vividly, and I don't know if you're hearing me right now or getting it. I do remember in the 90s. I remember thinking, why can't I be Jordan? Michael Jordan. Why can't I be the Jordan of dentistry? What do I need to do to be that? Well, surprise, surprise. There's only one way. You have to focus. The best way for you to do it, and this takes me back to my D3-4 students. It takes me back to the associates that aren't in a private practice yet. You have to start becoming great at one skill. It could be endo. You have the vehicles today that most of us didn't have to become amazing. Amazing. I know more than just a couple GPs that were amazing at endo and became endodontists. It could be ortho. I know many GPs have astonishing levels of skill in the arena of orthodontics. I don't care what it is. If it's something, listen to me. If it's something you think you want to train and become great at, I'm not telling you you can't train in anything else, but I need you to put 80% of your energy into one arena that you can become great at in the shortest amount of time. jumpstart it, and then always add to that skill. Now, I'm not saying this for self-serving reasons, and I've said it in so many other different podcasts, but there's no skill easier for you to become great at than to get your oral sedation permit. And let me just, don't turn on the radio now and block me out. The reason is because when you learn the ins and outs and the cons and the pros and the contraindications and all that off the table, when you give your first round of oral sedation, you're as good as the dentists like myself who've been giving it for 25 years. There really isn't any pattern that you become better than, that I'm better than you until you get to your 10th year. That's not true, really, in many other arenas, and you know it. And where you can play off this as an early graduate of dental school or as an associate, I don't care if my boss paid for the training for oral sedation. That would be my number one thing I would do, because it would put the star on your head in that practice. I don't get paid anything special from any pharmaceutical company for getting you to buy triazolam or Atarax or Benadryl or the different medications I personally use for my patients for oral sedation. There's nothing in this for me except to help you. I'm telling you, that would be the number one, because there's no way that you won't be as successful as I am. You will give and follow the protocols, a medication packet to a patient who will be sedated in 1 hour to 1 hour and 30 minutes, period. And you will have better clinical outcomes. And in 99% of the cases, if not more, they will say favorable things, and they will tell other people favorable things, and your practice will grow. Oh my God, you got to go to Dr. Cherry in Dr. Rasner's practice because she uses the sedation. I mean, I don't care where you're at, what country you're at. That's the number one skill. That wasn't my number one skill. I went out to spear and coys, as I've said to you, somewhere between 17 and 19 times in the 90s. And I really thought, and I learned amazing aesthetic gems, clinical gems. And I really believe that I did, and still do, very nice aesthetic dentistry. Since that time, it feels like half the planet has trained at the Spear Institute in Arizona, who doesn't even know I talk about them, by the way. Or Coys, or wherever else people go to train for aesthetics. But back then, there weren't that many people that were willing to invest that kind of money. And it really felt that I was distinct, and my confidence level was so sky high. So it wasn't even oral sedation. I didn't discover oral sedation until I was in my mid-40s. And that was subsequent to my implant training with Carl Misch. I mean, there's a good example comparing the two. There's probably no other skill I like providing for my patients than implant dentistry. But implant dentistry, you're not going to get in 6 months or 1 year or 2 years. And when you hear me teach my students to come to my institute, that is why I encourage you to take the first few years and do abundant bone cases. Do number 4 or 12 or whatever tooth has got thick genotype of gingiva and abundant bone. You just make your cases easy to build your confidence, because it's so easy to get thrown even when you are confident. And the thing is, it directly impacts everything you do. Your clinical outcomes, it directly impacts, obviously, your case presentations. So, again, you have to commit. I'm going back to the athletes for a minute. Sometimes I sit there. I hope this comes off correctly to you. When I'm with a patient, I remind myself that they are here because I have a special skill to offer them. Whatever I'm doing that day, whether it's aesthetic dentistry, sedation dentistry, removing teeth, by the way. Again, I don't even care if you come to me for me to teach you how to remove teeth atraumatically, efficiently, quickly. I mean, I like you to, but that's not why I'm talking about it. It is something you can learn very quickly. I can't say that that's the case, for example, even about grafting, because there's so many levels of GBR. There's so many levels. Are you grafting a socket? Are you grafting for horizontal augmentation, vertical augmentation? I mean, I did a bilateral sinus lift on Thursday, and I've done a lot of lifts in my life, and I don't do them all. I hadn't done any probably in 6 months. So it's not something, but I've done many. And it felt cool to have that skill and do it at a very, very high level and expect that I have really impressive outcomes. I hate talking like that because I won't know for 6 months, really. But my history of doing that procedure suggests that I will have another high level success. And when I presented it to that patient whose last teeth on his maxilla are his cuspids, and he could have not even first bicuspids. It was very unusual. Let alone second bicuspids and a first molar. This is a nice looking guy who is walking around with an abs, and he's can't be more than 50. And I remember giving him that recommendation, looking at, he had nothing. He didn't have any millimeters of bone in the posterior. He had width, but he had nothing vertical. And I knew I could do that case. In fact, those cases are actually easier for me than a case that has 4 millimeters, but we need 12 to 15. And I think that's the reason many of us, or maybe we forget it, do everything that we do. Because you have to develop a belief in yourself. I'll leave it at this, that you have this special skill. Maybe it's incredible direct composite restorations. Maybe it's indirect restorations. Maybe it's you have scanning and you're milling in your office now. I mean, there's so many avenues for us to become great at. But what you don't want to do is take a little of everything and become average to above average in everything. You need to become great at something to start the road to the highest level of dentistry that you can enjoy. And I know so many times at this point in my podcast, I say, I hope I'll pick up on that, but it's a good place for me to stop and pick up on next week. Thanks for tuning in. Come on, man. We've got to make, if it didn't happen for you in 2022, and it did for many of you, we need to make it happen in 2023. See you next week on the Lionheart.